Hello, it's Matt again. Just wanted to hop on and share a few brief thoughts related to OCD. Specifically, wanted to talk a little bit about exposure therapy and share my experiences with it. Um, Basically, the premise of exposure therapy is whatever you're afraid of, you expose yourself to. Um, This can apply to virtually every form of OCD in a variety of ways. It's kind of viewed at this point as the gold standard, and understandably so in treating OCD. Like with a lot of things in life, the most difficult are often the most rewarding and most effective. Um, Something interesting in my own life is that I have often found that I am more willing to perform exposures when the pain of the obsessions, living with the obsessions, the ruminations, and the compulsions is so unbearable that I would rather feel the pain of the exposure than live one more day or one more breath with the obsessions and compulsions. Obviously, this isn't ideal. If there is a way that you can be more wise or courageous and face your fears and expose yourself to them without having to reach rock bottom, that's ideal and that's the best. All these things being said, I want to make a point and emphasize that every single effort should be validated. Every single effort matters and counts, should be celebrated. I think there can be this misconception that, oh, the exposure therapy, unless I face my fears, face my worst nightmares, is this even going to be effective? For example, if you face germ OCD, germ fear, you don't have to go wash your hands in toilet bowl water and then eat with them in order for it to be effective. You don't have to, do something that's absolutely grandiose or absolutely nightmarish in order for you to see some results and help. Maybe with the germ example, touch a window pane with dust for a few seconds and let yourself sit with that and process it. And then perhaps most importantly, regardless of whether you feel you're successful or not successful when it comes to the exposure therapy, validate every single effort. Become your biggest supporter. Every person with OCD needs a support system, and at the core of that support system